As everyone probably noticed, on April 5th, Dan Little sent out a note to the campus reintroducing the smoke-free initiative. And as a reminder, all three campuses are going smoke-free by July 2011. Medical campus has been smoke-free for some years now. And so we're following suit with well over 260 universities. And so we're not unique, but at the same time, kind of neat from a state of Michigan perspective that after our announcement, as far as the restaurants in the state of Michigan goes smoke-free this May. So there's a culture of health in our community, mindset, and we know that it's an opportunity for us to continue on with our health initiatives. Here in Dearborn, we know we have some uniqueness as a regional campus, but most importantly for this initiative, how we're set up geographically, and also the culture of being a community campus with students that come and go every day without residence halls. So there's a lot of uniqueness to our campus in comparison to Ann Arbor. So we have set up our own smoke-free implementation team, and most of the implementation team is here, and I appreciate that. And I'll just call out the names for everyone. Chris Day, Laura Drabchek, myself, Larry Hicks, Ken Kettenville, our new Director of Communications, Lori Cornelson, Ken Harris, Christopher Tremblay, and Jim Zaras. We also have a student we hope will be joining us, and also we're looking to identify faculty members that will join our committee as well. The role of the Dearborn Implementation Committee is to really help put forward advice and make decisions around how do we communicate and how do we educate our community as we get ready for July 2011. So our role is kind of a dual role. It's advisory, but it's also a decision-making group. We know as a committee some of the decisions that have broad impact on the campus we may need to bring to the senior officer table. So as a committee, we've had approximately 3 meetings, and recently we've had 2 really productive meetings that have led to this event today. And we really want to kick off the collaborative two-way communication that we know will help us be successful as we implement. So with that, I'd like to say thank you to the committee. Jamie will introduce Dr. Winfield, and then we'll be able to talk a little bit about the process today. So thanks for coming.
So the process for this morning is we are first going to have Dr. Winfield talk a little bit about the initiative itself, why are we doing this, why are we making the change, what's happened so far, and then also what are we going to be working on now as we work towards implementation. And there's so many different ways that we can collect feedback from our campus community, and so this is one of many ways that we'll be collecting feedback for the committee to consider the implementation that we'll partake in on this campus. So after we finish with Dr. Winfield's presentation, feel free to ask him questions. He's here as a resource to us. And then we'll be asking you 3 questions that we prepared in advance to get more information from you about how we should go about implementing this policy on our Dearborn campus. Okay? So I'd like to introduce today Dr. Robert Winfield. He's the director of the University of Michigan Health Service and the Chief Health Officer for the University of Michigan. And he's been so kind to come on our campus many times in the past. He's been involved in leader in the development of many university policies of health-related concerns for our campus community. Some of those involve the pandemic influenza planning groups, as well as integrated disabilities management committee, and the M-Healthy 5-year strategic planning group that we all know a lot about on this campus. And he's currently a co-chair for the Smoke-Free University Steering Committee, and that's what we're here to talk about today. So we're glad to have him. Welcome.
Thank you, Jim.
Thanks for being here. This is a controversial topic, as you all know. We probably have somewhere between 10 and 15% of our staff on all 3 campuses are smokers, and we think about 10% of our students on all 3 campuses. But of course you have a unique campus with a different population that we haven't studied as closely, and so you may have a different smoking rate here because your student population is different. It's older, it's more commuter, it's made up of people with different cultural backgrounds. We know that in the United States there are pockets of groups of smokers that smoke more than the average 20% across the country. So you may have other challenges that are unique to the Dearborn campus. I thought I'd start with a little story of how I got interested in this, because I actually had plenty on my plate at the time and was trying to keep my head in the sand about smoking. Actually, several people had talked to me about it, and I just kept putting it off, and finally a group of students came to me and asked for a meeting, and we met, and they said, we don't know what to do in our residence halls because we have about 10% students that smoke, and they all smoke out in front of the building and around the doors, and we have some control over what students do. We could make a rule, but the other problem is all of the staff that are working in the residence halls, either residence hall staff or custodial staff or food service staff that smoke, and so we don't have any authority over them. And I realized that students were never going to solve this, and that I had to take some lead as the chief health officer. So I started thinking about it, and I actually took my time. It took about 6 months till I decided I was going to step up to the plate on this, and then I and my staff assistant wrote a white paper for the president suggesting that what we really needed to do was take the lead in Michigan, but follow Iowa and Indiana university systems, which had already gone smoke-free, and step up to the plate and take this on. And she thought that it was reasonable. We went to the executive officers, including the chancellors, and Chancellor Little was there, and I know that he was unsure about whether this was the right thing to do, and he went back to his deans and council, and they said, yeah, let's do it. You know, this is really a problem, walking through all this smoke. And so we finally reached executive officer consensus with several other people that had reservations, and then decided to just go ahead and make the decision, because I and others realized that it would be very hard to reach a consensus across all the campuses that this was the right thing to do, you know, including students and other staff and faculty. So we said, okay, we're going to do this. We're going to take 2 years to implement. And so we made the announcement. This is July 1, 2011, all 3 campuses would be smoke-free. Now, the background is that in 1998, the medical center went smoke-free. It had been smoke-free in the buildings, but they said all grounds will be smoke-free. And they were one of the leaders in the country to go smoke-free. They found it very challenging. It was, of course, a different situation. They had the moral, the right thing to do on their side. It was very clear that in a medical setting, you couldn't excuse smoking. But on the other hand, that's a time of enormous stress for both patients and families. And so how do you deal with that? You have a patient who's maybe, you know, smoking for 40 years and now has colon cancer, and they're in the hospital, and how do you help that person with all that stress, or their family members who are attending a terrible situation with a young child or a parent or so on, and they're used to smoking as a stress relief. So they set up a tobacco consultation service where every individual who was admitted to the hospital that had a history of smoking immediately had a consultation with a tobacco consultation specialist, were given tobacco nicotine replacement, and then the same thing applied to family members. They had an interesting kind of evolution of this because it was a culture change, and they chose to not be aggressive in enforcement to the point of ticketing people. They weren't getting citations. The officers were saying to people, we don't have smoking here in the building or around the entrances. You'll have to go such and such place to smoke. And for some time that people were smoking in the atriums and in the parking structures. And you know, this gradually, over a period of 10 years, they ramped up the enforcement of that. And there's a funny story that I think I'll tell you about the across from the entrance of the hospital, there's a bus stop, and it's a big kind of one of these partially enclosed bus stops. And in the bad weather, the smokers would cross the street in their scrubs, you know, and all that, and then they would go in there and they would smoke. And pretty soon, it was so smoky that the people who were waiting for the bus couldn't go in there. So there were complaints, and so then the bus stop was taken down, you know, the bus shelter. Then everybody was miserable, and so there were more complaints. So then they put the bus shelter back up, and they made a smoking and a non-smoking bus shelter. Then it was so dense in this smoking bus shelter that the smoke was so dense, people would come out of there and they would just reek of smoke. So then they had to set up a rule that you couldn't be in patient areas when you reeked of smoke, that you had to not smell of smoke. So this is evolving gradually, it's complicated. In the parking structures, they say you can't smoke unless you're in your car and your windows are rolled up. But I know that when I've been there as a patient, there's this one corner in this one parking structure where people smoke, and it's in the basement of the parking structure, and it reeks. So and that's 10 years after this was decided. So this is a gradual process. There will be a start date, and I'm convinced that it will take us a decade to get to a place where people just wouldn't ever think of smoking on campus. I mean, it will become something where it's just taken for granted. And maybe it'll be 5 years, maybe it'll be 3 years, but it'll take time. The president and the executive officers are clear. They don't want DPS going out and writing citations. In fact, in order to do that, it would have to be a regent bylaw, and we're not going there. So that's not on the agenda. On the other hand, all of us may have a responsibility to go up to somebody and say, I'm sorry, you probably didn't realize, but this is a non-smoking campus. And you'll have to stand in the middle of the road and get hit by a car. So, but we will, at least on the Ann Arbor campus, we're planning to have maps. And so I wanted to talk now a little bit about where we are on this. And it's understood that the Dearborn campus and the Flint campus will implement this in their own way because you have unique challenges. And so really all I can do now is talk about what we think is going to be recommended to the executive officers in September or October for their approval or disapproval. And we're aware that there are some real dilemmas, such as smoking shelters, what people call butt huts. And so I'll go over some of the thinking that we have at this point, but nothing is cast in stone, nothing. So we created 5 subcommittees. One is communications, and the communications subcommittee is made up of representatives from Flint, Dearborn, Ann Arbor, smokers, non-smokers, and ex-smokers, past smokers, and students, and faculty, and staff. And on this subcommittee, they have been talking about signage, what kind of signage is appropriate, how bold should it be, what should it look like, what kind of communication should be extended to students who will be applying to our campuses, because we know that students don't want to be surprised. Oh, I've just gotten admitted and now I find I can't smoke. So we want that prominent in the registration materials, in the brochures. We also are looking at how to communicate to our existing faculty, staff, and students so that they feel respected as much as possible, so that they understand that we are going to be smoke-free, but we're trying to do this in a way that is considerate of their needs. We also want to be able to communicate about some of the options for smokers. We have another subcommittee that is human resources, and the human resource group is looking at what kinds of policies and procedures ought to be put in place. For example, if somebody continues to smoke in a non-smoking area, how will we proceed? Since we're not going to be doing citations, how does a supervisor deal with that? Or how do we deal with it with a student who says, you can't tell me not to smoke. I'm going to smoke right here in front of the building. And then what do? How do you respond to that student? And of course, as we do with our staff and our faculty, there's a progressive discipline. What do we do with the students? And so we're working on that. We have a student life committee, so we have the HR committee for faculty and staff, and then we have a student life committee that's been exploring this with students. Probably the most interesting thing with the students is that that in the survey that was done on the Ann Arbor campus, which had a large number of participants, the number one reason for smoking is not socializing, but is stress reduction. And they see this as really a big, for the smokers, really the big reason. And Jeff and the rest of the committee have access to these surveys. They're very interesting. They will be different for this group of students here because the students here are older. They are professionals already in many situations. They have ongoing jobs, and so it's a different population. You're going to have to figure this one out for yourselves, I'm sure. We also have a Facilities and Grounds Committee. This subcommittee is looking at what to do with, and they include the public safety group, what to do with this issue of guidance for maps where you can and can't smoke, how you're going to behave as a public safety officer, how you're going to, how the facilities and grounds are going to relocate butt containers, trash containers. At Dalhousie in Nova Scotia, which was the first university on the North American continent to go smoke-free in 2003, their big problem has been that people cross the streets because they don't allow smoking on the grounds or sidewalks, so people cross the streets, and the merchants are upset because of the cigarette butts and the cups, because it's a cigarette and a coffee, and they don't have adequate butt containers and this and that. So we're aware of that, and it's going to be a challenge. We have to have adequate facilities for getting rid of the garbage that goes along with smoking. And then there's another group with 5. We did communications. That was first. Communications, student life, HR, facilities and grounds, guests and athletics. You all have some auditoriums. I assume that you have some situations where you invite the community to come in to maybe come listen to a concert or a speaker, and and of course all 3 campuses have that situation. And then there's intermissions, and people are accustomed to, at the intermission, stepping outside and having a cigarette, and we're not going to be able to help them with that. We're not going to be encouraging people to step outside and have a cigarette on the plaza in front of the building. So what are we going to do for those people? How are we going to handle that? And so that's part of guest relations. Athletic relations, it's just been decided that the entire stadium inside that big gate will be smoke-free as of September 1, 2010 for the first football game, because most of the stadium now is covered and enclosed. The surround is no longer open like it used to be. And so with the new stadium, the executive officer decided we're going to make that happen a year early. So one of the things I had raised, and we haven't made a decision about that, is are we going to have nicotine lozenges available, like you go into a concert and they have those little nice Ludens or whatever's that you can suck on so you don't cough? Are we going to do something like that? Having nicotine replacement patches or lozenges available for sale or for giveaway. And we haven't made those decisions yet. I think some of the most challenging issues are the curbs. And there are, in Ann Arbor, we have 2 kinds of campus. We have one kind of campus where it is, and this is the Ann Arbor Central Campus, where we have city streets adjacent to campus property. And thus far, best we can tell, is that the city street has a adjacent right-of-way that includes the sidewalk, and that's under joint jurisdiction between the university and the city. The city does not have an ordinance where you can't smoke on the sidewalks, and so we believe that we are going to, of necessity, allow people to smoke on sidewalks adjacent to public streets because of the joint jurisdiction. And then we look at North Campus, which, as Jeff pointed out, is very similar to the Dearborn campus in that all the property is owned by the university, and all the roads, parking lots, and everything else is part of university property. Now, on North Campus, for some years, the students living in North Campus housing have not been allowed to smoke around the buildings, in the buildings or around the buildings, and they would walk out to the road or to the parking lot and smoke. And by the way, that population has a lot of Southeast Asian students, and they have a very high smoking rate in the male population. It could be as high as 50% in the Korean students. So that's kind of a good test area, and they have complied with that because, of course, in Southeast Asia, the culture is to follow the rules. So that's been relatively easy. So we're talking about what do we do with all these roads that go through North Campus? What do we do for the employees? How do we be respectful of those people who smoke, who can't walk 8 blocks to find a non-smoking road, a non-campus road? So we haven't finalized our recommendations, but we think that it's too confusing to have one set of rules on Central Campus and another set of rules on the North Campus, and B, we don't think, at least for the first few years, it's realistic to have people have to walk 8 blocks or 6 blocks to get to a city road where they could smoke on the curb. So we're struggling with this, but we think that we're probably going to end up recommending that people be allowed to smoke on the sidewalks of streets, but not on loading docks, and not on driveways, and not on concrete patios in front of buildings and things like that. So we haven't figured that one out, and you're going to have a big challenge because you have a large area where the only public road is a busy, busy, busy road. And so you got a real interesting challenge. I think that's most of what I wanted to touch on. I'm sure that there's questions. So yes.
I have a question. Do you know if the committees have talked to the city of Ann Arbor, and if so, what their thoughts are about now all these potential University of Michigan smokers moving to the sidewalks and the streets of Ann Arbor that used to be on the campus property?
Mm-hmm. I know that the city attorney was looking at the jurisdiction issue, my understanding is that confirmed what I said about jurisdiction. The city council hasn't taken this up, but I did talk to merchants, and the merchants, and I don't think you have merchants around your campus, do you?
The Fairlane Mall.
The Fairlane Mall.
Across the way, but
yeah, I imagine that will be where a lot of smoking might occur, is where people take their lunch break or something. But we have a different situation where there's merchants literally across the street. The merchants were concerned because they already have to pay private firms to clean the sidewalks once a day because of already the cigarette butts and trash. And the city will not do that. So they hire a firm that does that, and they're thinking that they're going to incur additional expense because students will naturally gravitate to the coffee house or this or that and smoke outside the coffee house more. So they were concerned, and they sit on a couple of the subcommittees, the grounds and facilities and the guest relations. So, but that's all I can say on that. Mm-hmm. Other thoughts or questions?
At this point, is the university considering any financial relief for faculty and staff who may be smokers who are going to get some smoking cessation options?
Thank you. That was what I forgot. So just to repeat, because I'm wearing this microphone so nicely, the question was, what is the university prepared to do or considering doing for faculty and staff that are smokers that wish to stop? The first thing is that all faculty and staff have the access to the Tobacco Consultation Service, which is a behavior-based set of sessions, and I understand that it will be available here on this campus, and there's no charge for that. And it's 8 sessions, and they have a relatively high success rate compared to people who try on their own. Typically, a person who tries on their own requires about 9 quit attempts. So it's a pretty addictive drug. The second part is that the the provost is considering for the overall budget as part of mHealthy a trial period where the over-the-counter tobacco cessation drugs, Nicoderm, nicotine gum, lozenges, may be considered in the generic class of medications, so that with the proper prescription, I could go into the drugstore and they would pull up an authorization from the University of Michigan as an employer staff that would allow me to buy my $40 Nicoderm patches for $5. Now that hasn't been approved yet, so we'll see. We'll know by July, well, we'll know at the June Regents meeting. The 2 most important tobacco cessation drugs, bupropion, also brand name is Zyban, and Chantix, are at really relatively low expense for our faculty and staff. The bupropion is $5 a month, and you can have 2 3-month courses in a year. And then the Chantix is at $15 a month, and you can have 2 3-month courses for that. And either of those will increase the quit rate from about 20% to 50 to 60%. So those will be available as part of our pharmacy benefit plans. And there are also several programs that are available through our health insurance. For instance, HAP has an online program for quitting tobacco use. The Premier Care, BCN, Blue Cross Blue Shield all has Quit the Nic, which is also free. And then as part of mHealthy, if you take your HRA, I heard that somebody was trying to get on and couldn't do it today, but if you take your HRA and you're a smoker and you choose to go through a tobacco cessation program, whether it's Quit the Nic, or it's the Tobacco Consultation Service, or it's the HAP program or Priority Health, if you go through that program, whether you succeed or not, you're qualified to get $100 cash incentive to just go through the program and complete it. So those are the 3 main parts to this. Other questions?
Can you add, I'm sorry, Devin, can you add a little bit about student support then?
That was our
Is that where you were
question.
gonna go with this? Yeah. What's available for students?
What's available for students? Now, on the Ann Arbor campus, we have a health service and a health promotion team, and we have a pharmacy. Our pharmacy is going to offer the over-the-counter drugs and the prescription drugs at our cost, which is still very expensive, I'm afraid, except for the bupropion. We'll eliminate our markup, but that's all we can do. We don't have enough money to do anything else. And then we will be offering free sessions for students with the Tobacco Consultation Service. Now, here on this campus, you may decide that you will blend those sessions with students, staff, and faculty. You may find that that works fine, but I don't know. You'll have to consider that. But we'll be offering those free. And then we're going to have a different tobacco cessation campaign from mHealthy, because we're targeting a much younger audience on the Ann Arbor campus. And as you heard they're smoking for stress relief. And they also smoke some for social activities, drinking and partying. They start smoking. So that's what we're going to be doing. Does that answer your question?
But our students here will not be able to take advantage of the prescriptions in Ann Arbor, correct? Because we don't pay that health fee.
No, you can. They can, if they want to drive into the U of M to get that. Certainly, yeah, yeah. They're over the counter, and some are over the counter. I don't know what the pricing is going to be right now, so I wouldn't be able to venture how much it's worth. You know, whether the cost of the gas is worth it. It might be better to go to Windsor. I mean, I just don't know. Have more fun in Windsor. Yes.
Any thought or considerations been made in Ann Arbor to give us some guidance here as far as non-tobacco products, such as chewing tobacco, or
Sure.
as an example, with the Arab population that we have here in Dearborn, use of hookah. May not necessarily have tobacco product, but it may have some herbal ingredients that may give off a smoke, so maybe that would go into the definition of smoke-free.
Yeah, it's an interesting dilemma. First of all, we consciously have not included chewable tobaccos because the evidence that they cause such serious health problems is small. Secondly, the motivation at the real heart of this whole effort is not to eliminate the irritating, unpleasant odor of cigarettes, but to look at the health issues. And so, while for those people who don't like the smell of smoke, this is eventually going to be a benefit, what we're really focusing in on is that for the students, we want to set an example, a model of a healthy workplace. And for our faculty and staff, we want to create that healthy workplace and encourage them, if they are smokers, to stop. The data says that a smoker, if they are a man, incur 4 more absence days a year than a non-smoker man. And if they are a woman, it's 6 more absence days than a non-smoking woman. In addition, we know that there's something called presenteeism, which is where you're present on the job, getting paid, but not working. Lots of presenteeism. If you've got a migraine, you might be sitting at your desk working at 50% capacity. But if you're a smoker and you take 6 or 8, 10 to 15-minute breaks a day for your tobacco relief, then you're present but not working. And so presenteeism is another factor. And then third is the long-term healthcare costs, where we know that if you are a smoker, you're going to incur more hospital costs and more healthcare costs every year as long as you're a smoker. And if you stop, after 3 to 5 years, those costs drop. You also, if you're a smoker and you stop smoking, may live another 7 years. So that's a big deal too. So I find that very compelling. Now, what do you do then when somebody wants to smoke some herbal thing? We actually have not directly addressed that, and we're going to have to come to grips with it. We do know that it's clear that marijuana, even though it may medically be allowable in this state, because the university is so dependent on federal financial aid and federal financial grants, the federal laws are going to trump our state laws for us, and we will not be allowing marijuana use on our campus property, even if it's medically directed. In terms of lemongrass or something like that, we just haven't talked about it. And I don't know the answer to that, but I will be working on it now that you've raised the issue. In terms of Arab Americans smoking hookahs, most of that is tobacco, and that would be included in this. So if students wanted to set up a hookah on the plaza and sit around and smoke, that would be just the same as cigarette or pipe.
The hookah bars are being included in the closures next month.
That's what I understood, is that that was not the business to be in. Yeah.
You mentioned possibly if the big house thing and potentially for those types of things. How about that with the smokers? Do they like that? Do they use it?
Well, so I have not been a smoker, but what I've been told is that when you're a fairly heavy smoker, you start, after an hour or two, start getting a craving. Now, there's two parts to that craving. One is that you're craving the nicotine because you're addicted to nicotine, your blood nicotine levels are dropping. And the other is the habit. You know, the take the breath and let it out, you know, and not having been there, I can't quite experience it, but my smoking patients tell me that it's both. And so as the nicotine blood levels drop, you get a physiologic craving, and if you're using nicotine gum properly, which is you chew it once and then park it against the gum, and against your gums and the lining of your mouth, then the nicotine penetrates through the mucosa into your bloodstream. Or if you're wearing a nicotine patch, the nicotine penetrates your skin and keeps your nicotine level up. Or if you have a nicotine lozenge, again, you have to park it. It doesn't get absorbed through the stomach, it gets absorbed through the lining of the mouth. Now, people don't always know that, and they, you know, if they're chewing their gum actively, it's not going to work. They have to park it. And then every about 2 minutes, they chew it once and park it again. My understanding is that that does help the craving. So, yes. And I doubt that they will give them away free if they do this at the stadium, because when one looks at the expense, I could see them selling them for $2, you know, or, you know, $2 for a pack or something like that. But I don't know if that'll come or not. Great questions. Any more?
Is there anything else about the students you mentioned? Remember that was a committee we talked about. Whenever you want to move with students, and what other advice can the community from your experience about our student culture?
So the question was, what other advice might we think about with student culture change? Well, let me ask a question before I do that. When you look at the people who surround the doors now, are they predominantly students, or are they staff, or are they faculty, or is it clearly a mix? What does it look like?
Well, I regularly see students smoking, but I asked my colleagues who work in this building and around you.
It's a mix.
It's a mix. And are the students, do they tend to be younger or older, or all of the above? Or it's a mix. Mm-hmm. Well, so if I was charged to try and figure this out, I would probably start out with a couple of focus groups, and I might focus in on the subpopulations, the students that come in the evenings, or the end of the day would be probably people that are fully employed, and then you might have daytime students who are a little bit younger, a different subpopulation, and try and understand how they might experience this. My guess is that people who drive in for an evening class are going to be able to tolerate smoking off campus more easily, you know, if you're in for a short day, versus the students who are here from, say, 10 in the morning till 3 or 4 in the afternoon, accustomed to eating lunch on campus, things like that. There may be different issues. I think that the people who drive a car here will also feel more empowered to go smoke in their car. What about the people that take the bus here? How will their mode of transportation affect the impact on them? And it may be that while on the central campus we decide not to have butt huts, and they're expensive to build, I understand. It may be that you all decide to have a butt hut or 2 bus shelters, one for smokers and one for non-smokers, out on Evergreen or someplace. I don't know how you're going to solve this one, but for the individual student who's heavily addicted, who doesn't have a vehicle to smoke in, and is here all day, this is a real dilemma for them. So I don't know how to solve these, but it presents some special challenges. Do you want to pursue me further on that?
It's helpful in the two best that we're going to do our focus groups. Two focus groups. We do have a group of students that come in, we do helping to build percentages, but we do have a video component during the day, and we have an evening group for both undergrad and graduate classes.
Most of the grads are in the evening, and a good number of undergraduates as well.
And just further on this, we know our faculty and staff numbers are fairly small. I mean, we have about 300 staff and about 500 faculty. And turnover is very low, as you probably heard. So as a committee, we talked about the comfort level being able to educate the faculty and staff. It's our student life, it's our commencement, our guests, our folks that are regularly transit.
The guest relations issue.
Right.
Yeah. And I think that guests, if you were, for example, to decide that people could smoke on the sidewalks adjacent to certain designated streets, maybe not in front of this building, but maybe some of the side streets, I don't know, you know, this is going to be a hard one to decide. You know, you could hand out maps of where people are allowed to smoke or where they're not. We haven't, you know, as I said, come to full consensus about what to do with the North Campus because of this, and so it's not simple. You could also have a transition plan where you have one set of rules for 2 years, and then in 2014 or 2013 it moves to another level. So there are a variety of ways to do that.
One of the concerns has been the estate, because we have people come in for wedding receptions and graduations and things like that. Those are always occasions where people are coming in to celebrate, and while they can't smoke within the building, they're always out on the grounds.
Yeah, and we have a similar situation where we have the Michigan Union and the Michigan League are frequent wedding locations, and their new contracts in 2011 will include that you can't smoke on the grounds. But again, it's a different situation because of the streets. So you've got a really different situation.
It sounds to me like nothing has been decided either in Ann Arbor or nothing out here, but can students smoke in their car on campus property? They can now, but when this thing comes in 2011, can students sit in their car on university property and smoke?
Well, of course, as I've emphasized, no decisions have been made. The only decision, the only decision that's been made is that the stadium will be smoke-free September 2011 for the first game. 2010, thank you. I would venture to guess, it's a guess, that people who are in their cars with their windows up can smoke, wherever they happen to be. Now, but you know, I just have to emphasize that decisions haven't been made. But I would guess that that will be one of the exceptions. Students, faculty, staff will be able to smoke in their car in parking structures or wherever on campus property. But I'm not sure of that.
Yeah, the decision has not yet been made.
Yeah. But that's a reasonable guess. Yes?
I'm in the same situation. I'm coordinating on that experiment on Sunday. And again, what are the parameters of the smoking? Because we have a parking lot that goes quite a distance. I see people trying to challenge us and say, well, if it's 5,000 feet away, you can smoke.
Yeah, it's an interesting decision. And I think what you'll probably end up doing is making some recommendations to your executive officers. And then that's where the buck stops.
Because right next door to us, we have again a private entity, the Fairland Club. It has no connection with us, and I can see, as you spoke about, that going over to them. And again, they're going to be incurring costs. So those are all things that I'm concerned about.
Yeah. Now, what happens at the athletic venues with the football game is that the university has taken responsibility, athletic department has taken responsibility for cleaning all of those sidewalks for blocks and blocks, because there's all sorts of trash that is accumulated because of the game, and they can't expect the neighbors to do that, so they do that. So it's conceivable that you'll find that tobacco butt situation becomes a problem, or it may be that you decide that on the perimeter of certain areas you'll have trash and butt containers all over the place. It's an interesting dilemma, and I don't think many places have solved these things. Yes, sir. Hi.
The university golf courses. That was my
I am 95% certain, from what I have heard from the athletic department, that they will be smoke-free. I think that they will. And then the next question is, so who's going to enforce that? And my guess is that it will be posted as smoke-free, and it probably won't be enforced anytime in the near future. Because who's going to stand around the greens and say, I'm sorry, sir, you can't have your cigar, or, So my guess is, from what I've heard from the athletic department, they are 100% behind this. They think it's the right thing to do in all their grounds and facilities, but they are not prepared to enforce it in these wide open spaces. There's some tailgating that goes on. That's another big dilemma. I don't think you have tailgates, do you?
No, but we have students that go to tailgates. Right?
Yeah, but on the tailgates, some of the tailgating spaces on University Golf Course. And we're probably going to have something posted that says no smoking, and it probably won't be enforced. But again, that hasn't been settled. So we're trying to create a culture of health. We're not trying to get people in trouble. We're trying to change people's behaviors. We're trying to be respectful of the people who do smoke, but also insist that they be respectful of the spaces that are non-smoking. Yes?
Do you find that when policy or regulations, people tend to quit smoking, or do they just become more creative and find other ways to smoke? Like, can we expect that in 10 years from now, our campus will be smoking less?
So, that's a great question. What happens to the smokers when you go smoke-free? How many of you remember when we didn't have to wear seat belts? All right? How many of you now still don't wear your seatbelt? Is there anybody in the car there enforcing it for you? Mostly not. Sometimes a spouse, But there's been a change in the culture of health. I think it took 30 years. All right? Now, in terms of smoking, we know from research studies that have been done in work environments that when you make the work environment totally smoke-free, it probably triples the smoking quit rate. Probably triples the smoking quit rate. So we anticipate that more people will be encouraged, that they're almost ready to stop, or they've tried, but it was hard, and this will just push them to the point where they're saying, I'm beyond contemplating, I'm going to do it. And so we think that's what will happen. Now that's very different for somebody who's just maybe taking a night class, who says, I smoke at work, I smoke at home, I can't smoke on campus. Okay, I can't smoke on campus. I'm not going to change my behavior. But people who live here, who work here, who are really embedded in the culture, they will say, I really ought to quit.
Yes. Because this seems like such a drastic change. Even smoking in public buildings has been around for years. People are used to just going outside. People are going to be accustomed to doing that at bars and restaurants now. Is there evidence that they'll start sneaking the smoke in the public in the bathroom in the building? Because it's such an inconvenience to go elsewhere that they'll just start bringing it inside.
I don't know the answer to that question. I haven't read anything about it. I don't know. I assume that kind of behavior will happen. We can't say in the beginning of every workday, smoking is not allowed in the bathrooms, disabling the smoke detectors against federal law. So I don't know. I think people do all sorts of things. I think the biggest impact on smokers is they feel like second-class citizens, that they feel beaten up, and that, and I think that's one of the good reasons to not emphasize that the smell of smoke is offensive. I mean, this is being done primarily for a health reason, a long-term health reason, and not because 80% of us don't like the smell of smoke. It's hard to be a smoker right now. A lot of households you have to smoke in the garage because you don't want the kids exposed, and other situations are you're in your workplace and you can't smoke there, and or you're in a restaurant and you no longer can smoke there, and shortly you won't be able to smoke in the bar. And so people who are addicted, it's not simply a choice. It was a choice when they were 17 or 22 or whenever they started, but now they're addicted, and the addiction is just about as bad as heroin. It's very, very, very hard to stop. Some people pull it off, some people can't, and it's very, very difficult. I have a patient who has had 2 oral cancers. He's 60, and he still struggles. He's relapsed at least 7 or 8 times with his tobacco use. So I think they feel beat up, and I feel they don't feel respected, and they don't feel taken into consideration. That's a big challenge. See, you're nodding. Were you a smoker once? You were a smoker once, huh? And Ken, were you a smoker?
Yeah, it's not fun to quit. But as someone who used to smoke, I'm now allergic to it. And it's hard for me to walk over sometimes and not work to smoke. But it's not fun to quit.
No,
It's not that hard, I've done it many times. Last time 7 years ago.
I feel the same. I feel the same as everybody who's had to go through drug and alcohol. When I was away from alcohol, so I know.
Yeah, it's hard. And, and so that's one of the themes of our effort here, is to try and be respectful of people who smoke and understand that it's not such an easy thing to quit or to deal with this. So, other questions? Good.